Hello everyone, welcome to our last live stream of this event. I'm your host, Dr. Sarah. I'm honored to have had you here with me this week. I'm so glad that you came to learn more about how you can make a real impact on your health. For our last stream, I wanted to talk about why we've been here this week talking about the missing links to healthcare and some of the numbers behind why that's so important. And I have a lot to get through, so without further ado, let's get started. So healthcare obviously is a very complicated issue. It's not a one-size-fits-all, and each country has kind of developed its own way to do it with ups and downs for each way. But let's look at some of the statistics. So the Commonwealth Fund is a private organization that was founded in 1918, and I forget the lady's name who founded it, but their entire mission is to gather all the evidence to support effective and efficient practices in healthcare and good outcomes. And so they analyze these 11 countries, the US, Australia, New Zealand, Canada, France, Germany, the Netherlands, Norway, Sweden, Switzerland, and the UK. And they kind of compare them and how they fall in different things. So first one is life expectancy. I believe these stats are mostly from 2018, but they might go a little bit further back. They're not too old. And on some of these, you'll only see 10 countries because there wasn't recent data available. But you can see for life expectancy, the US is all the way at the bottom. We're at 78.6 years. Switzerland's at 83.6 years. That's a big jump. 5 years is a lot. And this is not a new trend. We didn't just drop to the bottom. We've been at the bottom, and I cut off these charts so they would fit and you could read them. But we've been at the bottom since before 94. So for a long time, we have had the lowest life expectancy of all of these developed countries. Chronic disease burden. We have the highest chronic disease burden. In all of these countries, all of these people, and these are all per capita, so this is proportionately distributed. We have the highest rates of obesity. That's probably no surprise. The typical American diet is very high in processed foods. It's very low in nutrition. And that combined can cause people who might normally not have an issue with their weight to gain weight. We have the highest, or somewhere near the bottom, physician visits. We don't go to the doctor that often. And whether that's a good thing or a bad thing, hard to say. We also have the lowest number of physicians. So out of all the doctors that are out there, per capita, by population, we don't have very many compared to these other countries. We do a lot of hip replacements. We're only beat out by Switzerland and not by much. But that's also no surprise to me. We have a lot of injuries, and hip replacements are really common. Knee replacements are also really common. We have a lot of hospitalizations. We were only beat by Germany for hospitalizations for diabetes and hypertension. That's what HDN is. And these are chronic illnesses that are predominantly caused by lifestyle factors. And so these are things that we have the power to change. We lead in avoidable deaths. The light blue, if you can read it, is from 2000, and the dark blue is from 2016. So our avoidable deaths are going down, which is a great thing. It's a really good thing. But we still have more than any of these other developed countries. And yet, even though we have the lowest life expectancy, the least number of physicians, we go to the doctor the least, we spend significantly more than any other country does on healthcare. And what are we spending it on? We do a lot of hip replacements. We already learned that. But what else is out there? This is how the expenditures kind of break down as far as where those pieces are going. So out of pocket, people are paying 10% of this healthcare expenditure budget. The national expenditure is just under 18%. Medicare pays 21.3%. Medicaid pays 16.2%. And private insurance pays the bulk at 34.4% to the tune of $6.5 trillion. I don't remember if this is 2018 or 2019, but it's very recent. And that is a huge amount of money that we are mostly spending on things that we could probably prevent. So why do I care? Why did I go through the effort of putting all this together, of reaching out to these people, of bringing them in? let me tell you a little bit about me. You can see on the top left, that's me, my dad. My dad got cancer when I was young. If you read my bio on any of the Optum pages, you'll know that he got cancer when I was young. I was 4. He died before I turned 5. And he has been a big driver in all of the things that I've done in my life. It's so funny to me when I hear people say, I don't want to get old. And I'm like, how lucky would you be to get old? You know, my dad didn't get to see me graduate from high school or college or professional school. He didn't get to see me get married. He didn't get to be a grandfather. He didn't get to get old. I want to get old. I'll be proud of those gray hairs and those wrinkles because I have an amazing family to worry about, and I have so much joy. I'm going to have the best laugh lines because everything makes me happy. And he's just been a big driver in all of the things that I've done. And so as I grew up, I left home when I was 17. I graduated high school early. I left and I joined the Air Force. And that was an experience all on its own. And now I have this amazing family and a wonderful husband who supports me and these awesome dogs. I've wanted German Shepherds my whole life, and they're the best, absolute best. And it really comes down to loving life. I love my life. I can't imagine not wanting to get old. And, you know, a lot of people have probably read The Moral of the Starfish, but the story goes like this. Little boy is walking down the beach, low tide, and he's picking up the starfish and he's throwing them back into the water so that they don't die. And this man comes up and he's like, what are you doing? You're wasting your time. There's miles of beach and hundreds of starfish. You can't possibly make a difference. There's just too much. And he picks up another starfish and he throws it in the ocean and he says, well, I made a difference for that one. And that's really what it comes down to for me, because I would love to change the world. I would love to change healthcare. I would love for people to be healthier by themselves. And conventional medicine, traditional medicine, our physicians, our nurses, they're amazing. They are important. They have such an enormous purpose in our society, but that is not wellness. The hospitals are not there for healthcare. They're there for sick care. And if we can prevent ourselves from getting sick, then those hospitals are available for the people who are really sick. You know, we're one of the only countries in the world where people go bankrupt because they got sick. You know, my dad got cancer. We hurt even after he died because his treatments were so expensive and he needed such intense treatments. I certainly wasn't poor by any means. I grew up in Southern California. But, you know, we were upside down in our mortgage. I remember my mom asking me for my birthday money back because she had to pay the electric bill and she was short. Healthcare is expensive. We're spending too much on it and we need to start taking care of ourselves. I was looking up the statistics for this slideshow today and I came across one. I didn't include it, but the National Cancer Society estimates that 42% of cancers could be prevented by lifestyle changes. So that includes things like smoking, it's top of the list, excessive drinking, excessive body weight, nutrition. All of those things are factors that allow our body to enter an unhealthy state where cancer is possible to proliferate. And so it would be great to change healthcare. I would love to change the world, but that's not better than changing it for one person, because for that one person, it is their world. And that's why I want to do this. That's why I love working with people. It's why I didn't want to just do private practice or a traditional setting, because I want to reach more than that. So what do I have to offer you? I have an 8-week wellness program. We're going to eliminate your pain, transform your health, and live the life of your dreams, because when it comes down to it, it's really about living your life. I want you to see your children graduate. I want you to be a grandparent. I want you to feel good while you're doing it. I don't want you to be on the sidelines. And I'm a little bit of a goober, so we're going to have fun with it. Week 1, where are you starting? Where are you at? We're going to dig deeper into fascia. I know we talked about it. It seems like a lot this week, but there's so much more that we can talk about. What it is and what it's for. We're going to map out your wellness goals. What is your current wellness and what is your ideal wellness? What do you want to be able to do? What are your health habits? Are you already getting good sleep? Are you managing your stress? Are you having regular meals that are good nutrition? What is your life participation? So do you love to garden, but you don't have the energy, or it hurts too much to get down and dig in the dirt? Do you want to go out and be social with your friends? Do you want to go out and dance? What is it that you want to do, and why aren't you doing it? And of course, we're going to set a pre-assessment for your postural alignment. So we're going to look at where you are to begin with, because it's really hard to see where you have to go or how far you've come if you don't know where you're starting. So we're going to design your ultimate roadmap to wellness so that we know this is where you are. You're right here, and this is where we're going to go. Week 2, we are going to get you back on your feet. So we're going to talk about your feet and your ankles and how complex they are and how awesome they are, and more about your shoes, because shoes are so important. We had several people bring up the danger of shoes and how impactful shoes are on your alignment. And you'll understand how to stretch your feet, how to strengthen them, the secrets of myofascial release, so you can start walking without pain, so you can go, summer's coming. You want to go to a barbecue and stand in somebody's backyard while you eat, but it hurts too much right now. We're going to get you there. Week 3, you're going to get hip. I'm super hip, believe me. And this week, we're going to explore the anatomy of your hips. You think your hips are just the basic ball and socket joint, and when you look at them on the surface, they are. But their interaction with your glute muscles and your pelvis and your knees is much more complex. And so we'll look at the downside of sitting. We'll connect your hip alignment to your knee pain. Maybe we can get you without knee pain. If you noticed previously in the week, I showed pictures of my knees when I was talking about alignment. And I have had an ACL reconstruction. So in California, you can't use cadaver tissue if you're under 18. I was 15 when I tore my ACL. So they actually took a chunk of my patellar ligament and a chunk of bone on either side from my tibia and from my patella. And that's what they used to screw in to replace my ACL that was torn. And I also tore my MCL, the medial side and the medial meniscus. And I'm missing a significant part of that cushion in there. And yet I don't have knee pain. I ran a half marathon and my knees hurt, but my bad knee didn't hurt worse than my good knee because it has good alignment. And so we'll talk about those same things, how to stretch, how to strengthen your hips, the myofascial release that you need so that if you want to go dancing and you want to shake those hips, you're going to get out there and do it, and it's not going to hurt, and you're not going to hurt the next day either. Pelvis Presley, my favorite. Dr. Tamara was so amazing. And your pelvic floor is so important, and there's so many things that it affects and we don't realize it. So we are going to make friends with your pelvic floor, and we're going to learn some uncomfortable truths. Sometimes there's this kind of widespread myth that if you're having pelvic floor issues or you're having incontinence, it's because your pelvic floor is weak and so you need to do Kegels. But that's not necessarily true. It might actually be that your pelvic floor is too tight, that it can't release properly. And that can cause a whole range of issues as well. So we'll figure out, is your pelvic floor tight or is it weak? What are the things you need to do to fix that? Are you having issues with constipation? Are you having incontinence? More stretching and strengthening. We can focus on each of these areas independently, but ultimately they affect everything else. And the myofascial release techniques that you can do yourself for a pelvic floor as strong as your coffee and relaxed as your vacations, because it needs to be both of those things. Back on track, we're going to talk about the spine. Your spine is so amazing, and it has so many individual parts that work together so smoothly when it's going right, but it has so much risk when it's going wrong. So we're going to talk about anatomy and the dangers of comfort and how to protect yourself from injury, because back injuries are one of the most common injuries that are out there. You think about lifting correctly, you think about picking up your kids, bending over to do something. I think Sharon was the one who talked about she bent over to get something out of her dishwasher, load something in her dishwasher, and when she stood back up, she had back pain. So we'll do more stretching and strengthening because each of these parts needs all of those things and the myofascial release techniques. So nothing can hold you back. We're going to get that chip off your shoulder. Shoulders are challenging. We have a lot of shoulder issues too, a lot of shoulder replacements, rotator cuff injuries. We spend all our time working in front of us, and that brings everything forward. So we're going to move it back where it should be. We're going to open the chest. We're going to work on the traps. So if you're like me and you keep all your tension in your shoulders, we're going to fix that. You ever reach back in the car to get something out of the back seat, and it's like this entire section of your body seizes up, and it's so painful? We're going to make it so that doesn't happen anymore. We'll talk about the rotator cuff. We'll go all the way down the arm to tennis elbow, carpal tunnel if you have any of those issues. We'll do stretching and strengthening and self-myofascial release so you can have proud shoulders and carry the weight of your world like you should be. Your neck of the woods. This week, you're going to examine that stick that holds up your meatball. So my husband and I have this running joke about little kids because their heads are so big and their bodies are so small, they're like a meatball on a stick. You know, as we grow up, our shoulders get wider and our head's a little smaller in proportion to the rest of our body. So you just have a short stick with a smaller meatball, but it's still there. So we'll learn all about headaches. I used to have terrible headaches. Actually, for my doctoral educational component, you have to do a special project. And so I did a case study with a client who had like daily tension headaches and migraines. And I spent about 6 weeks of treatment, 8 weeks total of her logging. And we completely eliminated her migraines and significantly reduced the frequency and the duration and the severity of her tension headaches, which is interesting to me because I would think since tension headaches are typically related to muscle tension, those would have been more responsive to the myofascial release. But when I spoke with her about 6 months after we stopped doing treatments, she was still feeling better. She wasn't having the same issues she had. So we'll talk all about headaches. Talk about the curse of technology. Do you spend time like this? More stretching and strengthening. You need to be able to recognize when you're tight or when you're weak and how you go about fixing that. And the myofascial release techniques. I told you previously this week that my neck is my problem. I have, a pinched nerve or some damage up there that causes chronic issues in my shoulders. And when I spend too much time at my desk or I'm not paying attention to my posture when I'm sitting on the couch, I get really bad pain. And I have learned how to manage it so far. And I'm going to share those secrets with you. So we'll do self-myofascial release techniques so you can enjoy the road less traveled. You don't have to worry about pain or headaches. Week 8. This is the end. We're going to celebrate. On average, it takes about 66 days to create new habits. So in 8 weeks, you get, 8 times 7 is 56. You're almost there to the average. So we're going to look back and see how far you've come, how much progress you've made, all the improvements that have happened. We're going to look at the areas that might still need a little bit of work and make a game plan for those. And we're going to set new goals. So we'll look at how far your wellness has come, and we'll look at how much farther you want it to go. This is really about a lifestyle change, and the end, there really is no end. You can go as far as you want. And your life participation, are you back to doing the things that you want to be doing, or do we still have work to do there? Are there new things that you want to try? And these are really the tools to have a healthy, pain-free life. This is not about an 8-week course. This is about a life change. And it's the same with my clients that I see in person and practice. My goal as a therapist is to see them as little as possible. I want to fix the issues that they have, and I want to give them the tools that they need to manage it themselves, because this is expensive. I want you to be healthy. If you keep coming back to me, that means you're not healthy, and that means it's not working. So this is about really making a change for life and making progress and learning and growing. So we are going to eliminate pain, optimize function, and live your best life now, because what are you waiting for? And it's hard. Making a major life change is super hard. We get into these habits and these patterns and routines, and getting out of them is really challenging. But I've been where you are. I have been that person who was let down by conventional medicine. I didn't want to rely on pills and injections. When my shoulder first started hurting and I went to the doctor gave me trigger point injections and sent me to PT and told me that if it started happening again to come back and see him and we'd do it all over again. But I don't want those injections. I don't have time to spend hours a week at physical therapy because it wasn't solving my problem. And even though the pain came back, I ended up not going back to the doctor and not going back to physical therapy because I was able to manage it enough on my own that it wasn't impeding on my life, even though I still had pain, until I was able to figure it out myself. I felt guilty when I couldn't get down and play with my kids. My daughter was really little when it happened, and for a few weeks there, I didn't get to be the mom. My husband would have to pick her up and help me get me situated so that I could feed her or I could hold her, because I physically couldn't lift her. I couldn't contribute to the chores. We have a busy household. My husband works full time. I wasn't helping. He had to shoulder all that weight by himself because I hurt and I didn't want to, and I didn't have the answers yet. And I know you're probably thinking, it's an 8-week program. It's probably going to cost an arm and a leg. Sarah, my arms and my legs already hurt. What do I have to do? So the cool thing is, this is a beta program. It's a new launch, but that doesn't mean it's tried and true. These are the techniques and the tricks and the secrets that I use on my friends, on my family, on myself, on my clients. Other therapists are using these techniques in traditional settings, in rehab, in acute care, in private practice, with all kinds of diagnoses and conditions. Healthcare is not one size fits all, and this program is not one size fits all. But the beautiful thing is that I want you to learn your body so that you can adapt it to what you need. And so you'll be getting my secrets to fast track your pain relief, because that's really what it's about. So who has this worked for? I work with a lot of people who have chronic pain. I just hurt. I don't know why I hurt. It's usually alignment. And once we get that alignment fixed, and they know how to maintain their alignment, and they know how to treat themselves, and they know their triggers for when their alignment gets out of whack, then they don't need me as often. They often still come back because it's easier and it feels good, and it works faster, but it works for chronic pain. Fibromyalgia is believed to be associated with the fascial system. Your nerves travel through your fascia. Your fascia has nerve endings. When that fascia gets chronically tight everywhere, you're going to get pain signals. And traditional medicine kind of slapped a diagnosis on it and called it fibromyalgia. And there are some drugs on the market that are showing some reduction in pain levels with that. But now you're on a medication. It's not getting rid of your pain. It's just reducing it by a percentage. So how do we treat the actual cause? Repetitive and overuse injuries. Our lifestyles are such that we often do a lot of the same things a lot. We're typing. Carpal tunnel is an overuse injury. We are maybe playing sports, the same sport. Maybe you're on a softball league with some friends and your shoulder's starting to hurt from pitching. Headaches and migraines. I talked about the headaches and migraines. It's amazing how much the pain in your head is related to the alignment of the rest of your body. Plantar fasciitis. It's got fascia in the name. It's more complicated than that because your plantar fascia is thicker and it serves different purposes than the rest of the fascia in your body, or than most of the fascia in your body, but it works to fix it. Foot pain. I can help you with your foot pain. Bowel, bladder, and female health issues. If your fascia in your abdomen is so tight that it's pulling your organs out of alignment, you can have incontinence, constipation, excessively painful periods, things like that. And it's also great as a prophylactic. The best time to take care of yourself is before you get sick. It's before you get injured, because it's a lot like what Dr. Daniel was saying at the beginning of the week. You need to have those reserves for when you need them. It's like having savings in the bank and then you get a big expense. You've got that cushion to fall back on. Get healthy now, because there's going to come a time when you need to use it. But I have some bonuses for you to make it just a little bit better. Got 10. The first one is 10 yoga sequences. And this is not like you're going to go to a yoga studio and you're going to take a yoga class. This is super beginner focused. It's fascial focused. It's more like stretching, but in sequence. And so I can find my sheet of paper here. The sequences would include things like a sequence for runners, a sequence for morning, a sequence for bedtime, a sequence for headaches. So if you get an acute headache one day, you can roll through the sequence and see how that makes you feel. Shoulder mobility, hip mobility, spinal mobility, stress relief, balance, and then a full body mobility. So if you just need 10 minutes to move everything, you can roll through this really quick and know that you got movement in every part of your body so you can get on with your day. So you'll get this is what you'll get. You'll get the 8-week wellness program. It's worth $49.97, and healthcare is expensive. But you get this bonus for $149. You get another bonus. A lot of people, I've talked to a lot of people who have TMJ and jaw pain. And you know, you have chronic tightness because you clench your jaw all the time because you have anxiety and your job is stressful. And that also contributes to headaches. And all of this fascia in your face is just like the fascia in the rest of your body. Your face is your facial bones. You have a ton of bones in your face and they're supposed to be in a certain alignment. And most of them usually are. Your jaw has the most amount of movement and it's the most likely to get misaligned. So I'll show you my secrets that work on the jaw and relieve that jaw pain. And this is also connected to headaches as well. So you'll get the 8-week program, the 10 yoga sequences, the myofascial and the jaw pain. We're up to $52.95. And there's another one, full body alignment exercises. You don't have to be a gym rat to be healthy. It doesn't take a ton of time. And these exercises are really focused on which muscles do you need to strengthen and how do you do them in correct alignment so that you get the most bang for your buck. So you'll get the 8-week program, the 10 yoga sequences, the myofascial release for the TMJ and the jaw pain, the full body alignment exercises for $53.94. So I had two choices. I could make this really cheap, I could sell as many as I could, and not really be as involved in the process as I want to be. Because this is about a life change. It's about a new lifestyle, a healthier way. And it doesn't feel right to me to just send it out into the world because I want it to be a success. I want you to feel better. Your success is my success. It's really important to me. Or I could require a little more investment, take fewer people, which allows me to give you more of my time and more of my resources and more of my investment in you. And so if all this did was make it easier to get out of bed in the morning, would it be worth it? If it didn't hurt when you stepped on the floor, if it didn't take an hour for your body to get rid of all its stiffness so that you could go about your day, if it reduced the amount you spend on managing your pain. Prescriptions are expensive if you're on prescription painkillers, if you're on over-the-counter painkillers, if you're having to go to physical therapy, those out-of-pocket costs can get really high and they add up over time. So if you could reduce all of that, if you could get rid of it, what if you didn't have to go to physical therapy anymore for that copay? What if you didn't have to take all those drugs that are hard on your body? You know, the opioid crisis is real. It's happening. People are getting addicted to painkillers because they threw out their back and their doctor gave them some opioids. And now they're addicted and they, you know, that's a whole another can of worms. But if you could just reduce the amount you spend, would it be worth it? What if you got to do the things you wanted to do? What if you got to get out there and plant your garden? What if you got to take your husband or your wife dancing? You got to go out and do something fun. You got to go snowboarding or just on a hike. You got to go do something. What do you want to do? Would it be worth it if you could do those things? Or what if you got more pain-free years to spend with your family? Like I said, that's my ultimate goal in life for myself, is to live as long as possible. I want to get old. I would be a centenarian. I think it would be amazing. And getting old doesn't mean not living your life anymore if you take care of yourself. Because you can get healthy now and it'll spread out for a longer amount of time. So this is what you'll get. The 8-week program. The 10 yoga sequences, the myofascial release for TMJ and jaw pain, the full body alignment exercises. It's a $53.94 value, which is totally worth that. What is a pain-free life worth to you? How much do you value your wellness? It's really hard to put a price on feeling good. But your health is an investment. You should be investing in yourself. It's not an expense. Our current society allows your healthcare to be an expense, and you really should be starting early and using it as preventive wellness. So I know, get on with it, Sarah. Just tell me what it is. Do you need an arm? Do you need a leg? I'm not giving you my firstborn. This is the value of the program with the bonuses, $53.94. But that's not what it is today. $43.94. $1,000 off is pretty good. That's like 20%. It's not $1,000 off. Today, if you are ready to commit to a healthier lifestyle and a better life, it's only $497. If you pay it in full, or you can do 6 payments in 95. And now you have 2 choices. So option 1, do you do nothing, continue taking the pills, putting unnecessary wear and tear on your body, eventually cause enough damage that you need costly and risky procedures? Are you going to need a hip replacement? Are you going to need a knee replacement? Maybe a shoulder replacement? Maybe you end up in a wheelchair? Or are you going to invest in yourself? Be proactive with your health and your future. Save your time and your money. It's a bit of an investment up front, but over time it's going to be less. Significantly reduce the risk of the additional wear and tear and massively minimize the outcomes that you don't want. And since this is a beta program, I only have 20 spots. I'm really wanting to take the people who are ready to make that change. And because you guys joined this live stream event, you guys get the first chance to jump on this offer. But there's a caveat, because you will need to apply. Like I said, I'm only taking the people who are really ready to make a change, because your success is my success. And I can't have too many people where I'm not giving you what I know you're going to need. And so the real question is your future happy, healthy, and vibrant body worth a few minutes of time today to check this out? The discovery call is free. It doesn't cost you anything. If you want to sign up and get to know me more, or get to know more about my program, that's not going to cost you anything. So what are you going to do? Are you going to do it the old way? Are you going to do it the new way? If you aren't ready to sign up immediately, why is that? Is it too expensive? Do you feel like you don't have enough time? Have you tried other things and they haven't worked? I get it. I understand. I'm just another human being. I'm just like you. I have 2 kids and 2 stepkids. I have a full-time job. I have a working husband who works more than full-time. I have a busy household. You saw my dogs in the pictures. We also have 5 other dogs, 5 cats, a mini pig, and a cockatiel. So it is a zoo in here. But if I did it, you can do it. My kids are young. I still find a way to make the time, because it's about adjusting these techniques to your lifestyle, not changing your life. This is not, in the end, it is a major life overhaul, because you have to get healthier, but it won't feel like it. So what you'll get my 8-week program. You'll get the 10 yoga sequences, the TMJ and jaw pain exercises, the full body alignment exercises. And it's only $497. So if you are interested in learning more and you want to jump on a call with me, or you have any questions, please get in contact with me. There will be a link going out for you to sign up. And if you're ready to commit to wellness and to take it to the next level so that you can be happy and joyful and pain-free, I'm here to support you in that. Let me know how I can support you. Thank you guys again. That's all I have for you today. I am so glad that you guys joined me on this adventure. It was awesome. I loved hearing all the speakers, and hopefully I'll hear from you again.